Okay, imagine this for a second. The actual shape of tiny cells, red blood cells, in an animal's bloodstream could be giving off these silent warnings, signals about pretty serious health problems may be brewing inside.
Yeah, it sounds a bit like science fiction, doesn't it?
It really does. But today, we're doing a deep dive into something called spiculated red blood cells. They're these, well, fascinatingly misshapen cells, and they can be a really vital clue for vets.
And what's really striking, I think, is that these unusual shapes aren't just some random cellular glitches. You can almost think of them like the body sending up these tiny misshapen flares, SOS signals.
Flares, I like that.
Yeah, signals that experienced vets are trained to spot, sometimes really early on, maybe even before the animal shows more obvious signs of being unwell.
Right.
And their presence often points, quite directly actually, towards underlying issues with really crucial organs. Think liver, kidneys, maybe sometimes even the spleen.
Exactly. And for this deep dive, we're working from a really informative medical text. It basically lays out the fundamentals of anemias linked to these spiculated red cells.
So our mission today.
Our mission, yeah, is to really get to grips with what these cells are, what conditions, specifically thinking liver, kidney, spleen problems their appearance might signal, and really why noticing these tiny microscopic changes is just so critical for understanding an animal's health.
And we're mainly talking dogs here.
Mostly dogs, yeah.
Yeah.
The source mentions it happens less often in cats, but we'll touch on that too. It's all about giving you a clearer picture of these important diagnostic clues.
Okay, sounds good. So let's dive right in. What exactly are these spiculated red blood cells we keep mentioning?
Okay, let's break it down. Spiculated red blood cells are, well, pretty simply, red blood cells that have these little spiky bits or maybe bumpy bits sticking out from their surface. They've lost that normal, smooth, roundish shape.
Right, they're not the usual biconcave discs.
Exactly. And the material we're looking at, it highlights two main types that seem particularly telling. The first are called acanthocytes.
Acanthocytes, okay.
Yeah, picture these like red cells that are sporting, say, anywhere from 2 to maybe 10 projections. But they're described as elongated, kind of blunt, almost finger-like projections.
Finger-like, okay. And the significance?
Well, the key link here, according to our source, is often with liver disease. That's the main association for acanthocytes.
Okay, liver disease, got it. And the second type?
The second type mentioned are Burr cells.
Burr cells.
Right. These are described more as oval-shaped red cells. But instead of those, distinct finger-like things we just talked about, their membrane has a more irregular look. Maybe ruffled is a good word.
Ruffle, yeah, I can picture that. Less defined spikes, more like an uneven edge.
That's a good way to put it. And these Burr cells, they're more commonly seen when there are kidney problems.
Oh, okay. So acanthocytes lean towards liver, Burr cells lean towards kidney. That distinction seems important.
It does, doesn't it? That difference in shape, the morphology, seems like it could give some real clues right off the bat.
It really can. While, both are technically speculated, the specific shape, the morphology, it does offer clues about which underlying problem might be going on.
Interesting.
And it's also worth noting the text mentions that even though acanthocytes have that strong liver link, in some rare cases, you can see these acanthocytic anemias with only splenic disease, no obvious liver issue.
Okay, so mostly liver, sometimes spleen alone for acanthocytes, and Burr cells, mostly kidney. Now, this is where it gets really interesting for me. The why. What's actually causing these cells to change shape?
Right, what triggers it?
Yeah, why do these normally smooth, sort of donut-shaped cells, shaped perfectly to squeeze through tiny capillaries, why do they suddenly sprout spikes and ruffles?
Well, the exact nuts and bolts aren't completely mapped out, but the information we have points pretty strongly towards abnormal lipid metabolism. That seems to be the most frequent culprit.
Lipid metabolism.
Yeah.
So something to do with fats.
Exactly. The idea is that there's an imbalance leading to free cholesterol getting loaded onto the red blood cell membranes.
Loading onto the membrane, like sticking to the outside.
Sort of integrating into it, yeah. And that excess cholesterol seems to alter the membrane structure and flexibility, causing these shape changes.
So it's like the cell's outer layer gets unbalanced, maybe stiffened in weird ways by these extra fats.
That's a great analogy. Think about trying to keep a balloon perfectly round. If parts of its surface suddenly became less stretchy or thicker, it's going to bulge or pucker, right? It won't maintain that smooth shape.
Okay. That makes intuitive sense. Now let's dig a bit deeper into those organ connections you mentioned. The link between acanthocytes and liver disease sounds pretty solid.
It is, yeah. The source is quite explicit about seeing acanthocytes frequently in dogs with diffuse or widespread liver diseases.
Diffuse, meaning affecting large parts of the liver.
Exactly, not just one small spot. And it even gives a really specific and quite serious example. Dogs with disseminated abdominal hemangiosarcoma.
That's a type of cancer, right?
Yes.
Aggressive.
Yes, a very aggressive cancer that can spread, and when it involves the liver, these acanthocytes are apparently often seen in the blood.
Wow. Okay. That's a very specific and, yeah, concerning connection.
It is, and the text also notes that the likelihood of seeing these red cell changes, or maybe the number of cell affected, often kind of parallels how severe the liver involvement is.
So worse liver disease might mean more acanthocytes.
That seems to be the implication, yes. More significant disease, more noticeable changes in the red cells. And interestingly, it's not just dogs. The source also mentions observing acanthocytes in cats with hepatic lipidosis or fatty liver syndrome.
Ah, good to know. It applies to cats too,
Yeah.
even if less common overall.
Error.
Okay, what about the kidneys then? We said Burr cells are more the signal there.
That's right. While you can sometimes see acanthocytes with kidney disease too, it's less typical. The anemias linked to kidney problems more commonly feature those Burr cells, the oval ones with the ruffled edges we talked about.
And the same principle applies. More severe kidney disease, more likely to see Burr cells.
Yes, similar to the liver situation, the likelihood of seeing these cell changes tends to track with the severity of the kidney impairment.
Okay. And then there's the spleen. You said its involvement is rarer, less direct.
Yeah, the text definitely flags it as rare to see acanthocytic anemia with only splenic disease.
Mm.
But there's a really interesting clinical pointer mentioned specifically for large breed dogs.
Oh, what's that?
Well, it says if you have a large breed dog showing just vague signs of illness, maybe lethargic, off their food, nothing obvious, or if they're found to have an enlarged spleen on examination,
Okay.
the presence of acanthocytes in their blood could be another clue. It sort of raises the suspicion for either splenic or hepatic hemangiosarcoma in that specific scenario.
So in that context, large dog, vague signs, big spleen, seeing acanthocytes as weight to the possibility of that specific cancer in either the spleen or liver.
Exactly. It's like another piece of the diagnostic puzzle in that particular clinical picture.
That's fascinating. So these funny shaped cells can actually be a really important clue, maybe even when the animal isn't acting terribly sick yet.
Absolutely. That's one of the key points the source emphasizes. In many animals with these spiculated cells, the anemia itself might only be mild or moderate. They might not be showing really obvious clinical signs of illness at all,
Right.
which is why finding these abnormal red blood cells just by looking at a routine blood smear, a peripheral blood film, can sometimes be the very first sign that points towards a potentially serious underlying problem in the liver, kidneys, or spleen.
That really is a potential aha moment, isn't it? Something you see under a microscope, maybe during a routine check, could be the first tip-off to a much bigger issue.
It absolutely can be. It underscores the value of looking closely at blood smears.
So if a vet does see these cells, what's next? How do they figure out if it's liver, kidney, or maybe spleen trouble? What's the diagnostic path look like?
Right. Seeing the cells is the first step. The next is figuring out the why. And that's where further diagnostics are crucial. The source highlights blood tests specifically, a complete blood count, or CBC.
Which counts all the blood cells.
Exactly. And a biochemistry profile. This is the blood test that measures lots of different chemicals, giving you that snapshot of organ function we mentioned. And alongside those, a urinalysis is really important too.
Urinalysis is okay.
These tests together are usually key for helping differentiate between a kidney cause and a liver cause.
Can you maybe break down some of the typical findings? What might point towards the liver versus the kidneys in those tests?
Sure. So for potential liver issues on that biochemistry profile, you might see elevated liver enzymes, things like ALT, ALP, GGT.
Enzymes that live inside liver cells.
That's right. So if they're high in the blood, it suggests liver cell damage or leakage. You might also see high bile acids, maybe high serum ammonia, and sometimes low levels of proteins like albumin or low BUN blood urea nitrogen.
And the urinalysis for liver.
With liver problems, you might find bilirubin in the urine. That's called bilirubinuria. Or even actual bilirubin crystals might be visible under the microscope.
Okay, that seems like a pretty specific set of clues for the liver. What about markers for kidney trouble?
For kidney disease, the biochemistry profile often shows elevations in things like BUN again, but also creatinine and phosphorus. These are waste products the kidneys are normally supposed to filter out.
So high levels mean the kidneys aren't filtering well.
Precisely. And the urinalysis in kidney cases can be quite variable, but you often see something called isostenuria.
Isostenuria, what's that?
It basically means the kidneys have lost their ability to concentrate or dilute urine properly. It's stuck at a certain specific gravity, kind of like the blood plasma itself. The text gives typical ranges 1.008 to 1.0025 in dogs, 1.008 to 1.035 in cats, indicating this loss of function.
Okay, so the urine is too dilute, essentially.
Or rather, not concentrated enough when it should be. You might also see things called casts in the urine, little molds of the kidney tubules, or signs of inflammation like white blood cells, pyuria, proteinuria, or even blood hematuria.
Wow, okay, so it's really a combination looking at the cell shapes, then using these broader blood and urine tests to really zero in on which organ system is struggling.
Exactly. It's putting all the pieces together.
The source also mentions imaging, like X-rays and ultrasound. How do they fit into this picture?
Imaging is vital, absolutely. It lets vets actually look at the organs themselves. Radiographs or X-rays give a good overview of the abdomen, but abdominal ultrasound is often even more helpful because it gives really detailed images of the liver, kidneys, and spleen.
What can you see on ultrasound?
You can assess the size and shape of the organs, look at their internal structure, their texture. Basically and importantly, check for any masses, tumors, cysts, or other abnormalities that wouldn't show up on blood tests alone.
Makes sense.
And the text also mentions that sometimes to get a really definitive diagnosis, especially if there's a suspicion of cancer or certain types of liver or kidney disease, biopsies might be needed, taking a small tissue sample.
Right, for microscopic examination. Okay, so once you've gone through all that and you have a diagnosis, say liver disease or kidney disease, what's the approach to treatment? Can you actually fix the spiculated red blood cells themselves?
That's a really important point. The source is quite clear. The treatment isn't aimed at the red blood cells directly. It focuses entirely on diagnosing and then managing or treating the underlying disease.
So you treat the liver problem or the kidney problem or the spleen issue.
Exactly. The spiculated cells are a symptom, a consequence of that primary disease. So the medications, the management strategies, they'll vary hugely depending on what that root cause actually is. Treating liver failure is very different from managing chronic kidney disease or dealing with a splenic tumor, for instance.
Right. Different problems, different solutions.
Absolutely. And importantly, the text also stresses the need for monitoring. Doing periodic CBCs, checking those red blood cells again during treatment, helps assess how the animal is responding as you manage the underlying condition. Are the spiculated cells decreasing? Is the anemia improving?
So the key really isn't about directly fixing the cell shape. It's about fixing the problem that's causing the cells to change shape in the first place.
You've got it. The cells are like, well, like smoke. You don't treat the smoke, you find and put out the fire. Seeing these cells, in my experience, it's always a signal to look deeper, to figure out what that underlying fire is.
That's a great analogy. Okay, so let's try and wrap this up. If we were to boil it down, what are the main takeaways you'd really want our listener to remember from this deep dive into spiculated red blood cells?
I think the most crucial things are, first, that these oddly shaped red blood cells, acanthocytes and Burr cells, they're more than just curiosities. They are significant microscopic clues.
Clues
Pointing towards potentially serious underlying disease, particularly involving the liver, the kidneys, and sometimes the spleen in our pets. Second, finding these cells on a routine blood smear can often be the very first warning sign that something's wrong.
before other symptoms even show up sometimes.
Exactly. Which really highlights just how valuable routine blood work, including that crucial blood film examination, can be in veterinary medicine. And maybe third, recognizing these cells helps guide the diagnostic process, prompting those further tests like biochemistry and urinalysis to pinpoint the affected organ.
Absolutely. It's really quite fascinating how these tiny, almost invisible details at the cellular level can give us such vital insights into an animal's overall health, isn't it? I hope this deep dive has maybe illuminated that connection for you, that intersection of cell shape and systemic disease.
It really is fascinating, and maybe it leaves you with a question to ponder.
Mm-hmm.
Thinking beyond just these specific red blood cell shapes, what other subtle changes, maybe at a microscopic level in all sorts of biological systems, not just blood,
Mm-hmm.
what other tiny clues might be out there signaling much larger health issues?
Mm-hmm.
It really makes you think about the power of careful observation, doesn't it? And all the hidden information that might be right under our noses just waiting for us to learn how to read it.